Hi, this is Ben from LiveFit, and in this video we're going to chat about knee pain. So typically knee pain occurs from tight ITBs. Now your ITB or your iliotibial band is a tract of tendinous muscle tissue which runs down from the top of your hip and attaches on at the base of your patella. So it actually wraps around your patella and attaches on down here at the front. So when we have very tight ITBs, then our patella can start to actually move laterally, and that causes knee pain in the form of patellofemoral syndrome. So patellofemoral syndrome is when our femur actually grinds against our patella, and that creates a lot of pain inside the knee, and also inflammation and swelling and sometimes fluid around the knee. Now, patellofemoral syndrome, or it's otherwise known as Itb syndrome, is really common, and the cause for that is normally unstable glutes and really weak core or transverse abdominis. So what has to happen is your adductors and also the ITB on the outside and your vastus lateralis, which is the outside quad muscle, they have to do the stabilization when you're walking, running, doing leg training, lunging, and as a result, you get this knee pain. So what we want to do is release this off, and often you'll find that will, in 90% of the time, will actually result in reduction of that pain in your knee. So there's a few different ways of doing it. We've got our trigger point balls, and we also have a foam roller, which is more for myofascial release. So with the trigger point ball, what we're going to do is lay on your side and have your hip on something soft, but our leg on something hard on the ground. Now we want to place that, now you can see my muscles there, we want to place it and you can actually see my ITB there. So you can see where it runs. It runs underneath the top quad and then above the hamstring, right through there. So what we want to do then is just pop it right in the midpoint and then roll over onto it. And you'll find you can just add one leg on top and add a bit of pressure in. And you stay here and you'll start to really feel that on the spot. Now, as it starts to release off, you may start to feel that refer down into your knee, which is a really good thing. If you're on a spot like that and it's referring, that obviously means that that's quite a traumatic point, so stay on it until that referring pain starts to go away. And that should really help release off any knee pain should you experience it. Now, if you want to add more pressure to this, you just simply pop the leg over on top and lean over more. Now if you want to get even more pressure again, you can actually go up with your hips off the ground, and that's quite extreme and that adds a lot of pressure and tension, but sometimes that's necessary, especially if you're used to it and you've been doing it for a long time and your legs are quite resilient. Now this is a really direct way of affecting that ITB, and I really like this as a preferred method because you can get in there and release off the actual point. Now what we can do is we can be specific and target the spot we want to. So we can start here in the middle and then work up higher, which is often where a lot of tension resides, and then we finish with a spot which is just above the knee. Now if you're experiencing quite severe knee pain, the most kind of traumatic point is right here, just above the knee. So if you can work just there and turn over onto that, you might get much more severe kind of sensation. It can be painful, but it's a type of discomfort which is good. It's not, as long as it's within reason, it's not too damaging. And you just stay in this position and really try and create space and relax those muscles. So if you can imagine that your ITB is a rubber band and it's stretched to its absolute limit, and that's when you're experiencing your knee pain. What we want to do is just alleviate some of the tension in that rubber band so it's kind of floppy in the middle, it's nice and loose, and that will take the pressure off the joint. So from up here in the hip, but mainly down here in the knee is where we feel it. Okay, now the other way of doing this is with a foam roller. So this is more to work on the myofascial part of the muscle. So we've got our fascia, which is a connective tissue which runs on top of the muscle. Now, the good thing with this is it's not as invasive and it's quite general. So we'll do more the whole leg. Now with this, we just want to set ourselves up and we want to roll down And we want to try and breathe in while we do this. Make sure you focus on your breathing. Roll down nice and slow right to the knee. Then take a deep breath in as you start to bring it up slowly, all the way. And then take it back down again. Now you can do this a few times, and this just creates a reaction and stimulates the muscle to release. I personally find that I don't get the same pain relief from this, but it's a good kind of daily practice or every couple of days practice to do. Now what you can also do is you can change the angle of this to also hit your vastus lateralis or more through the ITB. So if you want to get a little bit more on top of the quad and hit the knee that way, we can bring our foot over the top, turn over more, and then roll down that way. And then we can also bring it back. And what you can do is flick the muscle on top. So you can see that there. The muscle is just on top, and now I'm just on the ITB only. And bring it back down. Now if you do want to find some adhesions and really work through them, find the tight spots, which are generally up kind of from the middle half to the top. And then find those sore, tight, kind of knotted areas and just hold on them and let your body just relax off. It can be quite uncomfortable, but at the end it feels really loose and really nice and relaxed, and it will alleviate the pain in your knee. So I hope that helps, and employ some of these different techniques, and that will have a massive reduction in the amount of knee pain that you're experiencing.